We're implementing a baseline survey of our membership this year on cultural competence and actually trying to understand across our over 11,000 members, where are they on that, and in a more methodical way get that baseline and then be able to target education, facilitation, and other types of dialogue to be able to advance both of those. And certainly we are working with our education partners on the requirements that are needed for nursing students. That's another part of our mandate.
And what will that education look like both for your members and for nursing students?
That's a great question. They're actually in the early stages of exploring that. That is not a defined set of education requirements yet, but we are working with our partners to establish that. The education programs in Saskatchewan already have content in their programming. So it's not like there isn't content, but is it meeting the TRC call to action? Is it actually going to meet the requirements of future members to be able to have the cultural competence that they need to? There's a need for a very strong focus on primary health care and the social determinants of health, making sure that everyone, including Indigenous communities, everyone has access to a primary health care provider, a full team of staff and providers that can provide the range of services, but also not only healthcare, reaching out to justice, reaching out to education, reaching out and getting out of our silos so that we're actually meaningfully working together and trying to efficiently and effectively influence those social determinants of health, which of course are up to the Indigenous communities to tell us about, but how do we then help come together to influence that with them? Social determinants of health is a term that's used to mean that someone's health and wellness are not just a blood pressure, a lab test, a mental assessment. Those are aspects of health, but they are also their housing. Do they have clean water? Do they have the education in a way that is truly engaging and meeting their needs? And so it's the justice system, the education, the health. Many of the portfolios we think of as trying to help people, it's working together to influence the social determinants and actually make for health and wellness in the global way.